Despite a significant growth of studies, the association between digestible carbohydrate intake levels and the risk of cardiovascular disease and type 2 diabetes has been debated with conflicting results due to the presence of numerous confounding factors. Hi, my name is Zhen Wang. I'm a professor of health services research at the Mayo Clinic and co-director of Mayo Clinic Evidence-Based Practice Center. The title of the article is The Relationship of Digestible Carbohydrate Intake Level and Cardiovascular Disease and Type 2 Diabetes, a systematic review and meta-analysis. The paper will be in the March 2026 issue. In this systematic review and meta-analysis, we found a U-shaped relationship between the intake level of digestible carbohydrates and cardiovascular disease and type 2 diabetes. We included 30 prospective cohort studies with over 1.7 million participants. No eligible studies evaluated children under 18 years old. The association between the digestible carbohydrate intake level and the cardiovascular disease and the type 2 diabetes was nonlinear, which was supported by low strength evidence. The risk of cardiovascular disease was the lowest at the carbohydrate intake level of 50% of total energy intake. The risk significantly increased when the carbohydrate intake level exceeded 65% of total energy intake. The risk of type 2 diabetes gradually reduced with increasing carbohydrate intake level up to 45% of total energy intake, then plateaued between 45% and 55%, before rising with the higher carbohydrate intake levels. The nonlinear relationship were overall similar based on sex or geographic location. It is worth noting that the included studies in these reviews are from different geographic locations and include cohorts with a wide range of eating habits and the consumption of macronutrients. We conducted dose response meta-analysis to pull a wide range of carbohydrate intake levels across eligible studies. The included studies also report a wide range of participants with varying ages, which made it challenging to synthesize evidence for specific age groups within the adult population. However, this variability in age also makes the findings more relevant to a broader population. It is important to recognize that the quality of carbohydrate consumed may play a major role in changing the risk associated with carbohydrate intake. Aside from the amount of digestible carbohydrates, patients should avoid highly processed and refined foods and choose better sources of carbohydrates, such as fruits, vegetables, and whole grains. Future research is needed to separately evaluate the effect of starch, sugars, and fibers. As interest in lower carbohydrate diet continues, considerations will need to be given on how to best assess the long-term safety and efficacy of these dietary patterns. Last, no eligible studies evaluate pediatric populations. Future research that evaluates carbohydrate intake levels in children is needed. I invite you to read the article to see how evidence about the association between digestible carbohydrate intake levels and the cardiovascular disease and the type 2 diabetes.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.